First, I'm going to wash my hands before I start my assessment. Then I'll introduce myself to my patient. Good morning. My name is Shaquila. I'll be taking care of you today. Can you tell me your name?
Michael.
Hi, Michael. Do you give me permission to record this video and upload it for my instructor to grade and view?
Yes.
Okay, thank you. I will start my abdominal examination by inspecting my patient. I would inspect his eyes for jaundice. I would inspect this abdomen. I would inspect it by looking at the contour of this abdomen. It's nice and round. I would look for any striae, any erythema, any jaundice, any bruises, any scars. I would look on both sides of the abdomen. It looks nice, good and nice. Next, I would start with auscultation. I would auscultate all 4 quads of his abdomen, listening for bowel sounds. I would listen at least 5 minutes in each quad. I heard bowel sounds in each quad of his abdomen. That is normal or active bowel sounds. Next, I will auscultate the arteries. I would start with the aortic arteries, which is 2 centimeters above his umbilicus. And I would listen with the bell and the drum, listening for a bruit. I did not hear bruit. Next, I would listen for the renal arteries. I would listen with the bell and the drum. Next, I would listen for the iliac arteries. I would listen with the bell and the drum, listening for a bruit. I did not hear any. Next, I would do the femoral arteries. Listen with the bell and the drum. After I auscultate, next I would start with my percussion. I would percuss all 4 quads of the abdomen, and I'm hearing tympany. Tympany is a normal finding. It shows that there's fluid in the abdomen, which is normal. And the other sound you would hear would be dullness. I don't hear any dullness. Dullness could indicate enlarged organs or a mass. Next, I would percuss his bladder. I hear tympany, but you could hear dullness, which would indicate that they have a full bladder. You can ask your patient to go empty their bladder, but tympany is your normal finding when you percuss your bladder. Next, I would percuss to find my liver edge. I would start at the bottom, and I would percuss up, and I hear dullness, and that is 1 centimeter below the right mid-clavicle line, which is a normal finding. Next, I would percuss for the liver span. I would start low until I hear dullness. I hear tympany, dullness. I would mark that with an X, and I would go up his mid-clavicle line. I would do tympany. I would percuss in between his bones, not on the bone, because you will hear dullness. And once I don't hear tympany anymore, I would mark that line, and I would measure that area, and that is going to be my liver span. Normal liver span on the right mid-clavicle line is 6 to 12 centimeters. His is 7, which is normal. You could do it mid-sternal, and normal findings would be 3 to 6 centimeters. Next, I would percuss the spleen. I hear dullness, which is a normal finding for the spleen. After I do my percuss, I would start my palpations. I would start with light palpations just to see if there's any tenderness or pain for my patient. Do you feel any pain?
No.
You feel any pain?
No.
Do you feel any pain?
No.
Any pain?
No.
If I did feel pain in any one of those quads, I would not do deep palpations. So once I'm done with my light palpations, I would start with my deep palpations. I would put one hand and my other hand on it, and I would palpate. I'm looking for masses or enlarged organs. Do you feel any pain?
No.
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 Okay. After I palpate the abdomen, I would then palpate the liver. On this side, I would hook up under this side and have him take a deep breath and I would slide around and I would feel the edge of the liver. Exhale. Some people you can't really feel the liver if they're large, but smaller people you usually could palpate about 3 centimeters of the liver, and the edge should feel of the liver should feel real smooth and round. Next, I will palpate the spleen and have my patient take a deep breath. Okay, exhale. I did not feel his spleen. If I did feel the spleen, that could indicate splenomegaly and enlarged spleen, which is an abnormal finding. So the normal finding would not be able to palpate the spleen. Next, after I palpate, I will do my special test. The special test I'm going to do, I'm going to check for cholecystitis. It's Murphy's test, and you do that by doing a deep palpation on the right upper quad and have your patient take a deep breath. And if they sigh, that's a positive sign, which is indicative of cholecystitis, which is the inflamed gallbladder, which when they inhale, it irritates that gallbladder, so they'll have pain. So next, I'm going to do Robson sign, which is a test for appendicitis. I'm going to palpate the left lower quad, and if pain is felt in the right lower quad, that is a positive sign for appendicitis. That is the Robson sign. The next one I'm going to do is the fluid wave test. I'm going to have my patient, can you press down in the middle of your abdomen? And this is testing for ascites. I'm going to tap this side and feel for waves on this side. And I'm going to tap this side and feel for waves on this side. And that, that tests for ascites, and that's fluid in the abdomen. And if it's fluid, you can feel waves on whichever opposite side that you're tapping. Next, I'm going to have my patient sit up. Can you sit up? Can you turn around so we can get to the camera? This way. I'm going to check for CVA tenderness. I'm going to put my hand right here, and I'm going to hit that side. And I put my hand right here, and I'm going to hit that side. And if it's any tenderness, did it hurt any? Or if they squint you a little, that's usually indicative of polyonephritis. You're testing the kidneys. And that's all. Thank you so much.